Hi, good night, everyone. My name is Kelly Ann Douglas Benjamin, Brand Ambassador for Medicus Caribbean. Tonight, we are here to talk on the topic of anxiety. I'm going to look at the signs and symptoms, what is anxiety, causes, and possible solutions and treatment to anxiety. Tonight with me, I have very versed in the field, a psychiatrist with over 14 years experience in the field of mental health. He has served in both public and private sectors in Trinidad and Tobago. He is passionate about mental health. He's very down to earth. He's very committed to the field. I would like to welcome Dr. Rishi Ramoutar.
Hi, good evening, Kelly. Thank you for that wonderful introduction. I'm pleased to be here.
Yes, Dr. Ramoutar. So I'm going to ask you just to share a little more about your background, your medical background, and your field in mental health with us.
Sure. So I'm a psychiatrist by profession. That's my specialty. I'm a specialist registered psychiatrist for the Medical Board of Trinidad and Tobago. I have been in practice postgraduate now for 14 years, almost 15.
Okay.
My main specialty is on all types of mental health concerns, but anxiety is something that I have seen quite commonly in my practice, both public and private. And as a result, I think public education on anxiety is something that's important because there are many people out there who may not be aware of what's happening to them and they may need to seek help. Knowledge is power. And our goal tonight is really to give knowledge to the people.
Yes, it is. Yes, it is. So on the topic of anxiety, could you tell us exactly what is anxiety?
Sure. So anxiety is a natural response to stressors in life. It's something that we evolved over time as humans evolved, a way of responding to danger. So we're looking for danger in our environment and our bodies respond in a certain way to help us defend ourselves and protect ourselves. However, what can happen sometimes is that the body might have an exaggerated response that is out of proportion to what the threat is, or there may not be a threat at all, but our body might be perceiving a threat. And as a result, our body has these sort of overdrive of behaviors and thoughts and feelings that can lead us to being dysfunctional and not being able to achieve our full potential. And that, in essence, is what drives anxiety. Commonly, when people refer to anxiety, we refer to something called generalized anxiety disorder. That's what our as psychiatrists, that's the term we use. But there are many different types of anxiety disorders. Generalized anxiety disorder, yes, in fact, is the most common one. And some of the symptoms of that include excessive worry. So the person may be worrying, they may not be able to turn off the worry. It's hard to control it. So they're thinking or worrying about things excessively. And the worry that they have is out of proportion to whatever the stressor is that's causing them to worry. And they worry about many different things, sometimes simple things such as getting a task done, going to class, going to work, the traffic, all of these things. It's hard for them to get it out of their mind. They're constantly overthinking. And this is the main core, the classic symptom of generalized anxiety disorder. There are other symptoms that can go along with it as well, the typical symptoms that we're talking about. And these things can include difficulty in focusing or concentrating, or your mind going blank. That can happen. They notice during the daytime, their mind is going blank and they're not able to focus very well. They may have difficulty with sleep. Oftentimes, persons with anxiety find it difficult to fall asleep or stay asleep. Or they find that on mornings when they wake up, they don't feel rested, feel like they've tossed and turned all night and they wake up very tired. Another classic symptom is that tiredness or fatigue. They feel extremely tired or fatigued even after they have gotten sleep at night. They may also have tension, muscle tension, particularly in the back or the neck, but it can occur anywhere in the body. Sometimes headaches, like a tight band around the head, can be a symptom of anxiety as well. So these are some of the more classic symptoms of generalized anxiety disorder, which is the most common type of anxiety disorder. But there are also other types of anxiety disorders. All right.
Okay, those sounds like those sounds very familiar. Like, you know, sometimes you might have an exam to write, you know, you feel tense, you might get the headaches, you can't sleep in the night. But what really makes anxiety something for us to focus on in terms of it sounds like something that we go through on a daily basis. But when do we know that this is a problem, or maybe this is
Right.
unusual. How would we treat
Right. Right. So there are two main things you can look for. One is when the worry is so much that it causes you to be very distressed. So you're just
that?
distressed a lot of the time, and
Mhm.
it's causing you to be extremely overwhelmed. That's when you know, okay, well, something is wrong. This is not the normal anxiety or nerves, as we call it, that goes along with, like you said, something like preparing for an exam or
Yeah,
having a big job interview coming up. We have normal amounts of anxiety, and that's considered normal. However, if anxiety is making us feel overwhelmed and it's persistent, so it's lasting a long time and not going away, then we have to think, well, perhaps there's something more going on. The
right.
second thing to look for to determine whether this is normal or this is something more that needs to be checked out is
Mm,
that it's affecting your level of functioning,
mm,
meaning you're not able to do the things you're accustomed doing the way you're accustomed doing them because the
right,
anxiety is taking up so much of your time and energy in the day that you can't really get your tasks done. So you
right.
might have to stay home sometimes from work because you feel so overwhelmed. Or you're
Mhm.
in work, but you can't seem to get the work done because your mind is not focusing very
Yeah.
well. Yes, or you're in school and you're just feeling so nervous, so your mind is just distracted so much in class that you're not able to focus on the work. And this must be a change from what you're accustomed to. So
Okay.
these are the hints that would let us know that perhaps this is something more than just normal nerves or normal anxiousness that can happen in a life scenario. To say, well, perhaps this is something more that we need to take a look at.
Right. So in terms of that now, um, what could really cause, someone to experience anxiety? I mean, we
Mhm.
talk about the simple exam and stuff, but is it that since maybe the pandemic, have you noticed that there's a lot more persons that have anxiety? Is there certain
Yes.
things that trigger it? Tell us about
Mhm.
that, doctor.
Yes. So many things can contribute to people having anxiety. Stress is one of the main contributors, and certainly the pandemic was a major stressor for all of
Yes, it
us.
was. Yes.
Yes. And everyone processed that stress in different ways. Some persons were able to handle it in ways that they were able to still come out of it unscathed, and some persons it really affected them pretty badly. And life stressors like the pandemic, like difficulties in life, things that we experience every day, like financial stresses, relationship
Right,
problems,
right,
difficulties at work, those things when they are chronic, meaning they're ongoing for a long time, or they're very overwhelming, they can lead to the brain not being able to function properly because the brain has been under stress for so long. Then,
right.
then it leads to anxiety. So then you start having the symptoms that I described. Yeah, so stress is one of the main things. Some of the other possible contributing factors to anxiety are some medical causes. So persons who suffer from
Uh,
chronic illnesses meaning long-term illnesses, for example, things
right,
like diabetes, high blood pressure, asthma, sometimes cancer, things that can affect people for a long time, especially something like chronic pain. So persons who've had maybe nerve injuries or that sort of thing, or
yes.
physical injuries and then chronic pain, though that has also been shown to lead to people having anxiety. Certain drugs can lead to anxiety as well. So
Okay,
overuse of substances as common as caffeine. Caffeine is one of the things that can precipitate anxiety. And we
really?
know that, yes, it is. And some people who use a lot of coffee, drink a lot of coffee, and they're just very nervous all the time, that might be one of the contributing factors for
Oh,
them.
okay,
Yes. Other
okay.
common medical conditions, things like hypothyroidism or thyroid problem, can
Right,
also look like an anxiety disorder. You can have very similar symptoms and anxiety disorder. So these are some of the things that can cause people to have anxiety. Of course, some of the risk factors, so things that might also clue us into
right,
this person might be more likely to have anxiety, is a family history. So if there's someone in your family, a first degree relative, like a parent, a sibling, who has anxiety disorder or depression, then that makes the person more likely to develop anxiety as a
mhm,
diagnosis. So these are some of the risk factors that we look for as clinicians, and these are things that persons can look around and see. Perhaps if your family is diagnosed with anxiety and you find you're feeling very stressed out and find difficulty coping with stresses, it might mean you have anxiety as well, and it might be worth speaking to someone about it.
But is anxiety something that maybe some persons might tend to overlook? Like, you think of it as a normal, like, yeah, I normally just get sweaty palms, or
Mhm.
yeah, I normally just
Yeah.
get. it sounds like it can be easily overlooked until it reaches to that stage, maybe when it really gets out of control. So is there anything that can be done in maybe the early stages, maybe when just coping, you have that exam and you just want to cope, in terms to help you to maybe when you reach a point where you realize it's not working, or what can we do on an everyday basis in comparison to the person who is now diagnosed with an anxiety disorder?
So coping with everyday stressors is really important because, like I mentioned, stress is one of the main triggers for developing an anxiety disorder in the first place. So if you are finding yourself having a difficult time struggling with a stressor, there are things that you can do to help manage your stress levels, all right? And this will apply to persons who both just are dealing with a normal stressor and want to help, or someone who's dealing with anxiety disorders. These things are all very helpful. It's really important to have relaxation time. So to intentionally do activities that promote relaxation for you. Now that may be different for different people. For some people, it might mean some alone, quiet time reading a book in the evening. Some people, it might be taking a long, hot shower. For some people, it might be just taking a walk outside. One of the most powerful tools that we have found to be helpful to combat not only regular stress, but also to combat mental health problems like anxiety and depression is exercise. Exercise is something that has been shown to be quite helpful. It boosts your mood. It helps you feel more energized. It promotes healthy sleep. So it's something that can be used in general as a coping strategy to help with stress, as well as with somebody who's diagnosed with anxiety. And exercise is helpful. And it doesn't have to be anything very special or complicated. It's a simple thing like a brisk walk, about 20 to 30 minutes, about 4 times a week. That's sufficient if that's something that you're able to do. So exercise is something that's important. Managing your stress levels as well. So looking at maybe dealing with these stresses that are happening to you. So if there's a problem at work, perhaps looking for a resolution, finding a way to deal with the stressor, as opposed to just letting it fester and build and continue to stress you out even further. And this is where sometimes therapy can be helpful. Yeah, we could talk to someone to be able to get some perspective and be able to find a solution to some of the things that are causing you to feel anxious in the first place. And then we can do other things like avoiding drugs and alcohol, because those things make anxiety worse.
Definitely.
Yes.
Definitely.
So avoiding drugs and reducing your alcohol intake helps significantly. Because what we know specifically about alcohol and anxiety is alcohol sometimes makes people feel less anxious by its nature. So temporarily, when you drink, you feel a little bit better. You feel a bit more calm, more relaxed.
Right. Yes.
And then what happens is that effect kind of wears off, and then you want more alcohol to get the same effect. Your body starts building up a tolerance. The stress doesn't go anywhere because as soon as the alcohol wears off, the stress comes back. The alcohol is a temporary kind of band-aid on the problem. It doesn't help you actually solve the problem. So the problem exists, the stress continues, and every time you feel stressed out, you reach for the drink. Then you go from 1 to 2 to 3 because alcohol builds up a tolerance. Your body builds up a tolerance to the alcohol. And then you develop a whole new problem of alcohol use disorder in addition to anxiety. And it's something we see far too commonly, especially in young men in our country, where they've had undiagnosed anxiety or anxiety problems that they haven't acknowledged, and they don't seek help for mental health. So they prefer to go and drink with their friends at the bar or drink at home, and it becomes an out of control situation. So avoiding drinks and drugs, specifically, and alcohol, when you are stressed out is important because those are unhealthy coping strategies, and we try to avoid that. All right. And of course, if you have a chronic illness like your diabetes, high blood pressure, your asthma, and you are experiencing anxiety, it's important to have those things managed carefully. Because if those things are out of control, if your diabetes is out of control, or your high blood pressure is out of control, that can certainly contribute to your anxiety as well. So if those are managed well, it can lead to better feelings of wellness, including reduction in anxiety levels. So these are some of the strategies that people can use that don't require medication that can help with anxiety.
Right, that's nice. But in terms of medication, most times there's a little, taboo about medication for any kind of mental health disorder. Can you shed some light about medication and correct some of the myths that we may have
Right.
in terms of
Yes.
those things?
Right. So the first thing to say is that medication is not always a solution. Medication oftentimes is a last resort for many people.
Right.
If a specialist, a psychiatrist recommends medication, it usually means that this is the best course of action for that patient at that point in time. We try to exhaust all other options first before we reach the medication because of the taboo, not because the medication is necessarily harmful, but we try to give persons non-medication routes to help themselves before we resort to medication. But
Okay.
medication has been shown to be quite useful. The types of medication that we use are called anxiolytic medications. We also use medications that are antidepressants that work for anxiety as well. The main types of medications, the anxiolytics, they are largely what we call benzodiazepines, which is a fancy name for a class of medications that help you feel calm, help you feel relaxed. They tend to work quickly and they tend to give you a feeling of calm and takes the edge off, makes you feel more relaxed. And oftentimes it helps a lot with things like sleep. However, these medications have the potential to be addictive, which is, I think, one of the main concerns that people have about them. So they have to be used responsibly. They have to be directed by your doctor. They're not medications that you should go and buy over the counter and take when you feel like, because they can be addictive. So we recommend that if you are going to be taking these medications, it should be under supervision of a doctor, hopefully a psychiatrist who's well versed in treating anxiety.
Right.
Because there's a way that these medications have to be used. There's a period of time they can be used, and there's a way that the medications need to be weaned off safely so that you get the benefit of them without the risks of developing a dependence on them. The second type of medications is the medications that we use to treat depression, antidepressants. And these are some of the common ones that we know are fluoxetine or Prozac or sertraline or Zoloft or paroxetine or Paxil. These are all probably names that people might be aware of. And we know them to treat depression. They're most commonly known as antidepressants, but they actually work really well. They actually work really, really well to help treat anxiety disorders as well. These are generally safe and they don't have the sort of risk of tolerance the same way that the other medications do, the anxiolytics. They tend to be less likely to cause those, and they tend to be used for a much longer period of time because they tend to have a much more long-lasting effect. So these are what we call a maintenance medication. So you may be on them for a period of time, of course, depending on the individual case. It's important to know that there's no cookie-cutter solution to anxiety. Each person is different, and each person will require different medication at a different dosage. So please don't go and take anybody else's anxiety medication. We've seen that happen, and it can have quite devastating consequences. So speak to your doctor before going and taking anybody's medication. It should always be under the supervision of a doctor.
Yes, we know in Trinidad we have a culture of this worked for me. Take this, it will help you. But really and truly, you should seek medical attention by a professional before taking any such medications in this sort of nature. But what I got from this today is that we need to know ourselves and to know when something is not feeling right, when something is out of the ordinary. So yes, we have the everyday anxiety, which we can, probably cope with because it might last just the period of time until we get that task done that we think that is causing us nerves. But if it is that we realize that this is going a bit longer and we can start doing, as you said, the exercise. There are a lot of persons who may not like exercise, but we all know exercise can be really a brisk walk. And you can walk in nature. I think walking in nature is very therapeutic. So if you have a nice park with greenery, things like that really work in terms of boosting mood. But importantly, we must also practice a little self-care because exercise should be part of our daily or maybe weekly routine. We should have a little bit of that, and we should have a little rest and a little sleep, and maybe not so much coffee in the morning. If we sleep well, maybe we wouldn't have so much coffee in the mornings. So, this is really enlightening. It is every day. We hear the words anxiety so often, and sometimes we maybe brush it off. Anything that you would like to add, Doctor?
Yes, sure. There are a few more things I'd like to touch on just for the benefit of our audience. Because we focus a lot on generalized anxiety disorder, or what we commonly call anxiety. But there are a few other things that can come along with that, or independent diagnoses on their own that I think people would like to know about. One of those is panic attacks. I frequently hear people complaining about these intense feelings of fear that they have, and they think that they're going to die. And they come to your practice extremely worried about these things happening. They oftentimes go to the doctor or the health center or the emergency room, often thinking they're having a heart attack. They run a lot of tests and everything comes back
normal. Yes.
And then someone tells them, perhaps you should talk to a psychiatrist, and that's when they come to see me. So panic attacks can be quite scary by their nature. And what a panic attack is a severe increase in fear and the feeling of impending doom. So you feel like something bad is about to happen. You feel like you might die. You feel like you might be getting a heart attack. And there are physical symptoms that come along with it. Like your heart might be racing, you might be cold sweating, your hands might be sweaty, you might have shallow breathing, you might feel like you're choking or you can't catch your breath. You might feel dizzy or feel like you're going crazy, get numbness and tingling in the hands or legs. You might feel like you want to throw up or your abdomen, you get some weird belly pains. You don't have to have all of these, but these are some of the things that can happen. And it usually reaches a peak within a few minutes, so it feels really intense, and then it starts to settle down a little bit, but it leaves you feeling very shaken up. And then it can occur again without a trigger. Anxiety attacks can sometimes happen with a trigger, sometimes even without. And panic attacks is something that we're seeing happen quite commonly in a lot of people, and it's also something that's very treatable. It can happen on its own, or it can happen in conjunction with other mental health problems, like an anxiety disorder or with depression or other mental health problems. Those can trigger panic attacks as well. So it's important that if you're experiencing this, and it can be quite scary, that it's something that you can be reassured you can get help for. It's something that we can treat quite easily if you see a doctor. There's therapy, there are therapeutic techniques that can be used, and there's also medication. That's an option for certain cases. So that's one of the things I wanted to touch on, that aspect of anxiety or panic attack, so that people can be aware of what they are. If you're experiencing this, you might not realize that it's a panic attack you're having. All right. I also wanted to touch a little bit, Kelly, on some stress relief techniques or anxiety reduction techniques that people can do for themselves at home. Right?
Yes.
One of the easiest things to do is some deep breathing exercises. And I'd like to teach our audience a simple breathing exercise that you can incorporate in your daily life. And this is not just for people who have anxiety, but it's one of the things that helps to reduce stress. So even if you're having a rough day, you don't necessarily have to have anxiety, but you can use it because it helps reduce your pulse rate, it helps reduce your blood pressure, and helps give you a feeling of relaxation. And it's something called 4-4-6 breathing. All right? The 4 and 6, 4 seconds, 4 seconds, 6 seconds. So this is the duration of your breath. So the first 4 seconds is a slow, deep inhale through your nose, and you're counting 4 seconds in your head. At the second 4 seconds, you're holding your breath. So you're holding it there till the count till 4. And then the last 6 seconds is a slow exhale through your lips as if you're blowing through a straw. And you're doing it very slowly for 6 seconds. And then you repeat that. You repeat it a few times.
Effect. It has an emptying effect, like you're just letting it all out. You're holding it in.
Absolutely.
But then you're just letting it out, but not too quickly.
Yes.
Just nice and slowly. Yes.
Yes, nice and slowly. That's a pretty simple technique that anyone can do. It doesn't require anything special. You can do it while you're driving. You can do it while you're at work. You can do it while you're at home. And the more you practice it, the more you master it, and it becomes easier for you to use when you need it. That's really helpful to helping reduce your stress levels if you're having a tough day, or if you're having an anxiety attack. It's something that can help you reduce that anxiety as well. So I'd urge people to practice the 4-4-6 breathing technique. It's really helpful, and it's something that I highly recommend to my patients with good success.
Yes, I believe that 4-4-6 persons should take note of that, and let's try to incorporate that in our lives. These days, lives are very stressed, busy. So, having a mechanism that you can use, that you don't have to take time away from your busy day to do, it makes it also easy that you can just, okay, let me just breathe, take a minute and just breathe. And I think that is really spectacular. That's great. We thank you for that, Doctor. Is there
You're
anything
very
else you would
welcome.
like to add with us today?
So as we celebrate our World Mental Health Day today, October 10th, I just want to urge people to understand that mental health is part of health. You cannot be healthy if your mental health is not in check. So just as well as you take care of your physical health, if something was wrong, if you had a broken leg or you had a chest pain, you would go to the doctor. If you're struggling with a mental health problem, please talk to a doctor. There is help available. These are medical conditions that we can treat, we can help you with. There are many things. If you're scared of medication, don't assume that all doctors are going to give you medication. There's talk therapy, there is exercises that you can do, there are things that we can teach you to do to help manage these symptoms. And there are also safe medications if it comes to that can be helpful. So my takeaway is mental health is health, period. If you have any concerns about your mental health, please talk to somebody. Help is available.
Yes, mental health is real and there is help available. Anyone that wishes to have the expertise of Dr. Rishi Ramoutar can do so via our Medicas app. You can download our Medicas app and register, and he is in the psychiatrist section. And just remember today, I thank you, everyone. Thank you, Dr. Ramoutar. Thanks, everyone, for listening in today. And Medicas is putting quality care with availability. So thank you, Dr. Ramoutar, and do have a
Thank you
nice
very much, Kelly.